Good evening, everyone. I'm Dr. Anjali Kumar. I'm a gynecologist, and I head the Department of Gynecology at Artemis Hospital, Gurgaon. And plus, I also head my clinic, which is the Gynae Clinic in Gurgaon. So today we will be talking about the recent topic or the burning topic, which is the coronavirus. And it's the recent global public health emergency. So we'll be talking today about the coronavirus, especially since I'm a gynecologist. I'll be talking about the effect of coronavirus in pregnancy and how we can handle the entire situation. So, before we really go ahead and talk about the technical details, I would also want to tell you something about coronavirus. So, coronavirus is basically, it belongs to the group of viruses which cause diseases ranging from common cold to, let's say breathlessness, on some serious respiratory illnesses, wherein the patient actually may be admitted to the hospital, may require an ICU support or something like that. So why they are called coronaviruses is because they somehow resemble the crown, so that's why they're called coronaviruses. They've been there since ages. And recently, in December 2019, a new strain of coronavirus was diagnosed, was found to be the reason of respiratory problem in some patients in China. So that was the Wuhan district. And since it was a new strain means that, it has not been detected earlier. So that's how it is known as the novel coronavirus. And since it was detected in 2019, so it's called novel corona virus, 2019 virus. So why we are doing this is because this virus is very contagious. It started in China, and from there on, it is spreading rapidly across the globe, so much so that today's statistics actually say that it has spread almost to 108 countries. That means, we are actually sitting over a global problem, a problem which theoretically can have very big implications, very big health implications. So if we talk a little more about the, the virus. So this is it's in technical terms, it's an RNA virus. It's a little heavy virus. I mean, it's little heavy. So if it is in the air, it doesn't remain suspended in the air for some time. It, settles down on the surfaces. Also, it's a enveloped virus, which means it's got an outer lipid layer to it. And it typically spreads by the droplet infection, which means if somebody is having some kind of a respiratory infection and he or she is having a coronavirus infection, then that person, if that person coughs or sneezes, then theoretically that virus can get transmitted to another person through that droplet infection. That's how probably, it is spreading so rapidly. Earlier, like we all know, it was initially only in the China, but now it's slowly spreading to many, many countries. So much so, I was checking today's statistics that today the number of people who've been infected with the coronavirus 19, it's almost 1,11,000 till date, and it has the number of people who have died is about 3,800. So which means that till now, the mortality rate which has been seen is about 3.4%. which is sort of little lesser than what we saw at the time of SARS or MERS. So basically the SARS and the MERS, though, so SARS is basically the severe acute respiratory syndrome. So this was an epidemic which happened in 2002 and 2003. And that was a time where the the mortality rate almost touched almost 10%. Then we had a Middle East respiratory syndrome, which happened, I think, in 2013. So the COVID-19 mortality rate till now is estimated to be, almost about 3.4%, but it is still early. The virus is still spreading, and we are likely to see more number of patients. The numbers are bound to increase. So I think it's time that we really know the statistics, and we should know what causes the infection and what can be done about it. So first of all, I would rather say that, of course, it's a little serious situation. This is a pandemic, which means it's like spreading across continents. But at the same time, we're not supposed to be really panicking about the entire thing. And it's important to be aware, it's important to be cautious, and it's important to be taking the right kind of precautions. So, today, like I said, we'll be talking more about the coronavirus and pregnancy. There's been a lot of talk about coronavirus everywhere. The newspaper, the WhatsApp, and the mails, everything is flooded with the news of coronavirus only. And fortunately, the pregnant women don't have to do something special. The preventive actions which apply to the general population apply here also. So before we talk about what all you can do in pregnancy to make sure that you don't get COVID-19 infection, so let's first talk about what are the dangers, when somebody is pregnant, and God forbid if she gets exposed to the corona infection, what can happen. So pregnancy poses a lot of challenges to the human body. So in pregnancy, a lot of physiological changes happen in the woman's body. A lot of immunological changes happen in the human body. So much so the immunological responses in the body, they get altered, they get compromised. And it has been seen from our past experience of SARS and MERS that, or even otherwise, most of the viral respiratory illnesses, the febrile or maybe not febrile, most of the viral respiratory illnesses, they tend to have a little more severe course in pregnancy. So in pregnancy, women are likely to have, higher morbidity in terms of the increased severity of disease. Maybe there is a higher possibility of ICU admission, maybe an ICU support. And in rare cases, the mortality also tends to be higher in the pregnancy as compared to general population. Now, I don't mean to scare you all, but I just mean to say that it's important for pregnant women to know that they need to be careful. So yes, of course, the disease itself can have a little more, severe course in case a pregnant woman gets infected with the coronavirus infection. People have been also asking as to what kind of effect can it have on the baby. So fortunately, of course, the data is very less. It's a very recent virus, and it's, just as old as just probably, about 3 months old only. So we do not have the required numbers. We do not have the, the data and a lot of studies and as to what implications can it have. But we've again seen from our past experiences of the respiratory illnesses in pregnancy, that all these viral respiratory illnesses, besides causing a problem to the mother, also can increase the risk of premature labor. So women can go into premature labor. The women may have, medically what we know as, we call it as a small for date baby, which means that the infants born to these mothers could be slightly smaller in size. So, a woman can deliver early. On top of that, the baby could be a little smaller. And in previous times, we've seen some kind of viral illnesses. Like few years back, we had a Zika epidemic. We had the Ebola epidemic. So Zika was known to cause smaller head size in the baby, so in the fetuses. Medically, we call it as a microcephaly. So it's very, very early for us to say as to what corona is going to be doing to the mothers and the baby. But yes, of course, we need to be cautious on those fronts, which means that, we need to be following up these women, and we need to be following them carefully, so that, we we know that the disease is not becoming severe. And God forbid, in case there are any indications for the same, we need to really, probably get them to the hospital, place them in an intensive care support system. And of course, throughout the pregnancy, we need to be monitoring the baby as well. So, people have been also talking about, a lot of people ask me also, ma'am, does the virus gets transmitted from the mother to the baby? Now, that's a very serious kind of a point. So every mother gets worried, as it is so much of talk about the corona, so people are actually paranoid as to what is going to happen. And on top of that, you're pregnant, so whether it is going to affect the baby or not. So till date, whatever data we have, like I said, we are very new to the virus. No, virus is new to us, and we are also very new to the virus. It's been there just for 3 months. But whatever data we have till now, and whatever experience says as regards to the the previous SARS infection or the MERS infection, that it has been seen that the virus does not get vertically transmitted to the baby. Now, vertically means in utero, through the blood. The virus does not transfer from the mother to the baby, which is a good news. But then, we need to be sort of keeping an eye on this, keeping a track of how the things are developing. So I recently came across, a study in the Lancet. It's like a very reputed journal. So it was a recent study where they followed up 9 women in the China. They were pregnant, and they were, of course, diagnosed with a COVID-19 infection. But fortunately, none of the babies had any kind of a problem, and the virus was not shown to be vertically transmitted to the baby. And in fact, one of them delivered before 36 weeks. One of them had a premature rupture of membranes, but none of them had a very serious complication. But like I said, theoretically, pregnancy poses a lot of challenges, wherein these viral illnesses could go out of hand. They could become more severe. So we need to be knowing about about all this, and we need to be keeping ourselves prepared for the entire thing. Then also, like people talk about what kind of precautions. So like I said, in pregnancy also, we really, don't have to do anything special. The precautions which we are talking to the general people also apply to the pregnancy, which means, number one, since in this kind of a situation when there is so much of scare and paranoia around all this, So ideally, you should be avoiding going to crowded places and avoid any kind of a unnecessary or a non-essential travel. And in case it becomes really difficult to avoid travel, then also make sure that you are maintaining a good distance from the person sitting across. So, like I explained some time back, also that the virus is not suspended in the air. It's a heavy virus, so it tends to drop down to the surfaces. So you need to, you theoretically, unless and until somebody really coughs at you, you cannot get it. So make sure that you are maintaining that much of a distance from the person who's sitting across you. So which is about 1 meter or maybe 3 to 4 feet away from the person. And make sure that you don't touch your eyes, your nose, and your mouth. So it's a very contagious virus, and theoretically, it can go into the mucous membranes pretty fast. Also, people have been talking about that you must wash your hands. So washing your hand is very, very important. So, like I said in the beginning, this virus is it's an enveloped virus, which means that it has got a lipid layer around it, which means if you wash your hands nicely, then the virus goes dead. And in case you also here, you must wash your hands nicely. For about 20 seconds, you must wash your hands properly. And also the technique of washing your hand is also important. So it's not just like that. Make sure that you washed it nicely like this. Make sure that you're washing in between your fingers. Make sure that you wash your thumbs. Make sure that you wash the tips of your hand also, because these are the places which are commonly ignored. We just tend to wash our hands like that. So it's important that we take care of this area. We take care of this area, and also wash at the wrist also. So washing is very important, and like I said, simple soap and water also does the job. And in case you don't have access to the frequent washing with soap and water, disinfecting your hands with the alcohol rubs is also a good idea. Now, people have been talking as to second. Can't see any comments here. Can't see any comments. 1 second. Yeah. So yeah. So we were talking about. We spoke about the hand washing, and we spoke about the alcohol rubs. And also, like I said, this virus is a heavy virus. It tends to drop down to the surfaces. So it's very, very important in case you're a working woman, you've been working at your desk. It's very important to clean the surfaces also very nicely. So you can just clean the surface with simple soap and water, and later on, you can, once that area becomes dry, you can clean it with a sodium hypochlorite or maybe a bleach solution. So make sure that the table or the surface where you're working, it's clean. And I also said in the beginning that you should avoid travel to crowded places. And obviously, if anyone is having any kind of a throat infection, any kind of a cold or a cough, you must run away from that place. Not literally run away, but you must avoid that kind of a situation. And these days there's also a lot of talk about the travel history. Yes, of course, we need to understand one thing, that this is not our virus, which means that it did not originate in India. It has come to us from somewhere. So it has come to us through someone. So in case, you come across a person who has a history of traveling to these places, where we are getting a lot of cases like China, like Italy now. So we need to be careful. Of course, the government is doing a lot there, and there's checking which is happening at the airport levels, at the seaports. But we also need to be sort of cautious, like in your office or maybe in wherever you stay. So you need to be aware of all that. We have a question from Tushar Chakravarti. It says that if suspected, what should a pregnant lady do? So first of all is, how do you suspect that she has a COVID-19 infection? So like I said, the symptoms of a COVID-19 could be ranging from a simple cold and a cough to extreme breathlessness. So much so that she's really breathless, she's gone in a shock, she needs admission to the hospital, leading to multi-organ failure. Of course, we don't have to wait for that stage. So in case you feel that somebody's having cough and cold, you really don't have to think that she's having a corona infection. No, it's not like that. Of course, in case you feel that you're having all this, then of course it's very, very important that you go to your doctor. Tell your doctor, the doctor is going to take a detailed history. And in case you have a history wherein, you have a history of exposure to a confirmed case, then yes, of course, we need to test you. In case, like I said, you have a history, a travel history, wherein, let's say you travel from Italy and you travel from China and you're having these symptoms, of course, we need to test you. And now ICMR, this is the Indian Council of Medical Research, has identified certain places wherein your doctor can refer you, and you can go there. And of course, the required testings, this is we take a swab from the nose and the mouth, and it is sent for a PCR testing that can be ordered. But you have to remember, not every cold or not every cough or not every sneeze is a coronavirus. So also at this point of time, I would also want to tell you something about the incubation period also. For example, God forbid, in case you've been exposed to, let's say, somebody who's actually carrying a coronavirus, it's very difficult to know, first of all, if the other person is a carrier, because many times the person may not also show some symptoms. That person may itself be in a incubation period. So the point is, if you have any kind of a, infection, respiratory infection, it's important to go to your doctor, discuss with your doctor. And if your doctor thinks that you need a further testing, I'm sure the doctor would refer you for the further testing. But the most important thing is that you're not supposed to panic. Then coming to, a lot of people are asking, if the masks need to be used, if the sanitizers need to be used. In fact, there is so much of paranoia all across is that people are actually holding up the masks and people are holding up the sanitizers. So, let's not do this, because once a situation really comes where you actually need all this, and in case all that is out of stock, then we all will be in a big problem. So let's talk first about the masks. As a normal person, you really don't need a mask unless and until you've been exposed to a positive case. Someone who's having flu-like symptoms, let's say if I'm having a lot of cold and cough, it's imperative for me to use a mask so that I don't spread the infection to others. As healthcare workers, the frontline workers, the doctors and the sisters and the paramedics, yes, of course, it's a good idea to use a mask, because we don't know who's coming to us, who may be in the incubation period. And so it's important, in case you're a healthcare worker, you must use a mask. But as a routine, people don't have to use a mask. We just need to carry on the normal precautions, which I said: avoid going to crowded places, make sure that you wash your hands nicely, regularly, and make sure that the surfaces are clean. And one more also important thing, make sure that your immunity is good. You're eating good, you're keeping yourself well hydrated, you're sleeping well, you're exercising well. Make sure that your immunity is good. So most of the times, most of the infections, the body is able to take care of it in case your immunity is good. So, work on that also. Somebody has said if sanitizers are out of stock. So yes, so that's what I was telling. Please don't hoard the sanitizers, because when you actually need it, we will all be in a big problem. So the best thing actually is to keep washing your hands, maybe, every 20-30 minutes, just wash your hands nicely. Using a simple soap and a water is absolutely all right. Somehow, we can't see the somebody has asked, eating non-vegetarian food, can it cause coronavirus? No, it cannot cause coronavirus. Like I said, it spreads by the droplet infection. So eating non-vegetarian food is not a problem. So it doesn't spread like that. Will an increase in temperature will make the virus die away? We really hope so. So, this is just a hypothesis, maybe just a conjecture, that probably, in our country, when we reach a situation where it is, harsh summer, the virus will die. I'm really hoping, I'm really praying. So this is the time when actually everyone is hoping for a harsher summer this time. Really hoping it like that. So what are the symptoms and ways how corona can spread from one to another? So I spoke about it, that it typically spreads by the droplet route and also by the contact route. So, obviously you're not supposed to shake hands with people. So the Indian practice of greeting someone by namaste is by far a good greeting nowadays. Okay, then if someone is affected by virus, then how much time it will take to recover the patient? Now, most of the viral illnesses, typically, they start showing a downward trend by about 7 to 14 days, unless and until, God forbid, the situation has gone out of hand. But typically, by about 1 to 2 weeks, the patients start recovering. Yeah, somebody said keep calm and drink beer, not a bad idea. So what precautions should an individual take or a pregnant woman take if get affected? So in case you feel that you're having some kind of a respiratory illness, like some kind of a cold or cough, and if you're feeling breathless, please don't waste time. Please visit your doctor. Let the doctor do the assessment, what kind of treatment is required, whether you need to be tested further for the COVID infection. What are the mortality rate? How deadly is this infection? So mortality rate till today is supposed to be roughly about 3.4%. Yes, of course, it's a serious situation. Yes, of course, it's a deadly virus. It's a very contagious virus. But like I said, we're not supposed to panic. Most of the times, the disease is mild only, which means it's like simple cold and cough and a little bit of fever. But we need to be monitoring the situation well. In case a patient is showing signs of any deterioration, we need to be really getting into action. So yeah, again, everyone is asking non-vegetarian food. Somebody is asking, are babies safe from coronavirus? As I heard that it is not affecting the baby. So it's not like that the corona is not affecting the baby, but fortunately, the kind of data which we have till now is not many infants or babies or young children till now are affected by the coronavirus. Probably they're not traveling, and whatever the reason is, it's a good thing. But yeah, we're not getting a lot of cases when the children are effective. How worse is the situation in India? fortunately not that bad. I think till today we were sitting at some 400 plus patients, and I think 3 new patients were diagnosed today, and fortunately no mortality till now. So situation doesn't feel to be that bad, and all of us are really keeping a tab at every level. You know, the governments and the hospitals, the airports and the seaports, everyone is really working hard to contain the virus. If mother has coronavirus, will her newborn child will be infected? I spoke about it. That till now, whatever data we have is that the virus does not seem to be vertically transmitted from the mother to the baby. So that's good. Uh, so any diagnostic or confirmatory test for the infection. So I told you that in case, there's a positive travel history, or in case there is a history wherein, somebody has a strong history of being in contact with the positive case, then we order a test called a nasopharyngeal PCR. So we take a swab from the nasopharynx, from the mouth and the nose, which is sent for a specific test, which is known as a PCR. And what are the chances of death in coronavirus? So we spoke about it as just 3.4% till now. Should we include something in our diet to avoid getting infected? If yes, can you pass? So diet has got nothing to do with contacting the infection. So we spoke about it. How does the infection occurs? It is typically by the droplet infection or through the contact. Like, for example, if we are shaking hands with someone, or we're touching the surfaces where somebody sat there, then obviously there are higher chances. So diet, whether it is vegetarian, non-vegetarian, it's not the cause. But obviously, we should be having healthy diet so that our immunity is good, so that we don't contract any kind of infection. So, what are the chances of this? We spoke about any home remedy. I mean, we don't have any scientific data to support this. I mean, there are a lot of things which are floating around. People have been talking of some homeopathic remedies. People have been talking about all things like, some Ayush ministry said some cow's urine, and somebody saying some tulsi and ginger, whatever. So, I mean, I would just say, as a medical professional, I really can't comment because we don't have a scientific data or scientific evidence validating all these claims. But anything which is healthy, anything which is good in diet, any healthy diet, obviously will make sure that your immunity is good. Any home remedies? What are the mortality? How deadly? Yeah, is there any vaccine? No, we do not have a vaccine, unfortunately. We do not have a treatment. So, it's a very new virus. Probably, the agencies would take some time to develop a vaccine. And these kind of viruses, they mutate also very fast. Mutate as in their DNA constantly changes. It evolves when it goes from one person to another person. So it's a difficult job. So as of now, we don't have a vaccine, but I'm sure there are people working on this. So maybe we get something. Yeah. So somebody also has posted a question about the breastfeeding. Yeah, it's a very good question. I really feel if somebody is suspected to be having a corona infection, or maybe a confirmed case, what do we do? How do we handle? How do we handle the breastfeeding? So, obviously, as with all viral respiratory illnesses, we never stop the breastfeeding, but the usual precautions apply. So one thing is, again, all the scientific data says that the virus is not even present in the breast milk. So the question is whether the virus is present in breast milk or not. But I really feel the chances of the contact transmission from the mother to the baby during breastfeed, that is something which we need to be looking after. So, which means that the mother must wear a mask, so maybe wash her hands very nicely, disinfect her hands, and then breastfeed. Also, maybe she can express the breast milk and somebody else can give the breast milk. So yeah, it's a tricky situation. And the way this epidemic is going, I'm sure we'll have more numbers, and we'll see many more pregnant women, of course, lactating or breastfeeding mothers. So yeah, it's the actual problem which probably we'll have to face in near future. So yes, it's a difficult situation, but we all need to keep a calm, and we all need to be aware. We need to be taking the right precautions, and of course, look after ourselves. So please don't panic, and in case there's any problem, please consult your doctor. And let's not get scared of corona. Let's fight it. So I'm sure this was of some, I hope this was of some help to you. And thank you very much for logging in, and bye-bye.